So in terms of hypertension, which is a very common risk factor, as you know, for heart disease, I mean, the Singapore Ministry of Health issues its data and statistics every year, and consistently for the last few years, there is about the prevalence in Singapore, which is consistent with the global statistic, is that 25% of the adult population has hypertension. So it's a very, very common problem. And again, we see that in younger age groups today, again, partly driven by salt, partly driven by being overweight. And so often people are commenced on medication once it's proven that they do have a blood pressure problem. And we know that treating blood pressure early is very well described, amongst the literature, because it's such a common problem. There are many, many important trials, landmark trials, which document that lowering blood pressure reduces long-term cardiovascular morbidity and long-term cardiovascular deaths. So treating blood pressure is very important. Identifying blood pressure and recognizing blood pressure is one problem, because it's a silent condition. People are walking around not knowing that they have high blood pressure. So the initial recognition is something which we also educate on and get people to be aware to go and see their GP regularly again, and blood pressure measurement is a part of that process. Now, the treatment of blood pressure has various stages. So blood pressure tends to creep up with age and tends to get worse with age. And we often have to escalate medications from starting on monotherapy, often to combination therapies, as their blood pressure becomes more advanced and more difficult to treat. And that's also accepted, and patients have to accept that to keep their blood pressure controlled, they may need more than one, sometimes 2 or 3 medications. There is a condition which we recognize as resistant hypertension, which is when blood pressure is defined as more than 150 over 90 millimeters of mercury, and patients are still taking 3 or 4 medications. Now, this is a very advanced problem. And in the last 2 or 3 years, there is a new catheter-based treatment which burns away the nerves in the arteries supplying the kidney. Now, this procedure is called renal denervation, and it's been around in Singapore for 3 or 4 years, and I was involved in the very early stages of this technology being brought into Singapore. It's been around probably globally in Australia and Europe for about 5 or 6 years. So we reserve this catheter-based treatment, which is by definition invasive, for the more advanced and the more difficult to treat resistant hypertensive cases when medication alone is not helping.